So welcome everyone to our information session for our Master of Applied Science program in Patient Safety and Healthcare Quality. A couple of the presenters here today, I am one of them. My name is Morgan Fredericks. I'm the admissions officer for the MAS programs and the affiliated certificates. I will let Dr. Wu introduce himself, tell a little bit about himself, and then we will let Dr. Austin do the same.
Thanks, Morgan. I'm Albert Wu. I'm an internist and a professor of health policy and management in the School of Public Health, and also professor of medicine. I have been working on things related to safety for really quite a long time. I would say, in fact, since the late 1980s. In fact, some of the very first research that I did was back then when I was still in grade school. Might have been kindergarten, I don't recall exactly. But since then, I've been at Hopkins since 1990. I've been at Hopkins ever since then, with the exception of a couple of years spent at WHO in Geneva, working for the patient safety program there and helping things get off the ground. And I'm the director of this Master of Applied Science program, and also work on a variety of safety-related tasks for our Armstrong Institute for Patient Safety.
So
Matt, you're looking very you're looking a little compressed there.
I am. Some days I feel that way. But good evening, good afternoon, good morning to all of you. I'm Matt Austin. I'm an associate professor at the Johns Hopkins Armstrong Institute for Patient Safety and Quality. I do have a primary appointment at in the School of Medicine and Anesthesiology and Critical Care Medicine, and a joint appointment in the Bloomberg School of Public Health. In the Masters of Applied Science program, I do teach a course in the program, and I also serve as a co-director / advisor. So it's a pleasure to be with all of you and to have you here. I am going to ask Drs. Kent and Drs. Connor to introduce themselves as well.
Dr. Connors comes first in the alphabet, so I'll defer to Cheryl.
You are always just too sweet. Hi, everybody. I'm Cheryl Connors, and I am the Program Director for Organizational Resilience. I work for the Armstrong Institute. I am a nurse by background. I've been with Hopkins since 1999, and I've been officially with Armstrong Institute since 2012. And you guys, I think, are going to learn a lot about the programs that I oversee and that I worked very closely on with Paula and RISE with Albert. But those programs include RISE and CUSP and Just Culture and Safety Culture. And so I'm excited for you to get a whole lot of exposure to all of that. I'm an advisor. I am not a teacher of a course, but I am one of the co-directors and advisors. So hopefully I'll be working with some of you.
Excellent. Well, thank you, Cheryl. I'm Dr. Paula Kent. I am also a nurse by background. I have been working at Johns Hopkins for quite a long time, and I'm not going to say how long. I am currently teaching at the School of Nursing, teaching at the Armstrong Institute for Patient Safety and Quality, and teaching a Term 2 course at the School of Public Health. And I'm an advisor along with Dr. Connors and Dr. Austin under the direction of Dr. Wu. My focus in patient safety, I've been focusing on patient safety for, say, at least 15 to 16 years. And my focus within patient safety is essentially safety culture and some of the programs that Dr. Connors mentioned, including Team Steps, RISE, the Comprehensive Unit-Based Safety Program, and others. And we focus on those in the courses that I teach in both programs at the School of Nursing and the School of Public Health. So I'm excited to hear what you're interested in, and hoping that we provide you with everything that you need to know about the program. Thank you.
Okay, so as Matt mentioned, we are honored to have one of our graduates and a couple of our current students be with us here today. So I'm going to give them a little bit of an opportunity to introduce themselves. First, we have Rod Rodriguez.
Hello, everybody. Thanks so much, first of all, for allowing me to participate. I mean, I was honored to even have been asked to do this. But so I'm in the second year of the program. I'm a general surgeon. I've been in practice, it's coming up on 30 years in private practice of general surgery. Trained in Chicago at Rush Presbyterian St. Luke's. And currently I'm on clinical faculty at Medical College of Georgia and Philadelphia College of Osteopathic Medicine. I practice at it's a community teaching hospital system in Dalton, Georgia, which is North Georgia near Chattanooga, Tennessee, which is where I live. And I'm very appreciative of the opportunity to be here and to participate in this program.
Thank you so much, Rod. Now up next we have John.
Oh, you're on mute, John.
Hi, I'm Dr. John Valdrighi, and I'm a May 2024 graduate of the OPAL Master's of Applied Science in Patient Safety and Healthcare Quality. So I've recently just done this journey. My background includes over 25 years as a board-certified physician anesthesiologist, practicing in hospitals, surgery centers, and trauma centers. Projects I worked on in the hospital included enhanced recovery after surgery pathways and emergency manuals. Concurrent with my full-time anesthesia practice, I served 20 years as the chief operating officer for an oral maxillofacial surgery clinic. And I wanted to do more. I've been involved in patient safety for probably since when I first got out of medical school in the late 80s. Originally, I had checklists and notes that I worked on, and they carried them actually in cards. And then I put them I wanted to put them on a cell phone, an app, and I found that was problematic because every time the cell phone operating system updated, you needed to update your app. So I eventually moved towards saferanesthesia.com, a website, which makes it possible that you don't have to do an update. So wanting to do more, I approached my chief medical officer at the hospital and said I had this interest in patient safety, healthcare quality. And I was told that you're an anesthesiologist, put the patient to sleep. Johns Hopkins gave me the tools, the training, and the credentials to do more. Currently, I am the chief medical consultant in the California Department of Public Health, Center for Healthcare Quality. I oversee the work of 17 specialists, including physicians, infection preventionists, rehabilitation specialists, and physical therapy and occupational therapy specialists. I also advise the California Department of Public Health on patient safety and healthcare quality for policy and legislation and regulations. I completed the program in 4 years, and I did this while I was working. And it seemed like the classes were always just-in-time training. Whenever there was a fire at work, it seemed like that is exactly what we covered in class. And my advice would be to double dip. When you have a classroom assignment, apply it to your work. And when you have something going on at work, apply it to your classroom. And my final caveat would be, if you're a licensed physician in California and you complete this program, please give me a call. We need you. Thanks.
Thank you so much, John. And last but not least, we have Melanie. My apologies in advance if I missed some credentials near your name, but definitely take the time to introduce yourself, and thank you again.
No problem at all. So my name is Melanie Ello. It's nice to see familiar faces. I remember John in one of my classes last year. And I know Rod is also in my class this year. So I'm an acute care physical therapist. I'm originally from the Philippines. I moved to the United States in 2005. So it's been a long journey for me. But what really started me in this journey is that, the pandemic started, and I feel like we all have a lot of, like, needless to say, some free time to think about what we want to do. And I was looking through programs. A lot of them are geared more towards, I'm looking at programs that is different from physical therapy, basically. And all the programs that I've been looking at, like in public health, it tends to gear towards more of the admin part of it. And it really didn't appeal to me until I chanced upon this program, the Masters of Applied Science in Patient Safety and Healthcare Quality. For some reason, when I read that description, the subjects that are being taught, it really spoke to me. And I still remember my first conversation with Dr. Wu and, with Dr. Austin. So that really helped me in trying to find my path. I have been involved in a lot of, like, interdisciplinary or multidisciplinary initiatives at our hospital. So I work at a community hospital in Westchester, New York. So I've always been the go-to person whenever they need a person from a different discipline. So it's usually, oh, we have Melanie, pull them in for falls committee, for patient, certain, like, patient falls, or even, like, I currently had the safe patient handling committee in the hospital as well. So those were my starting points. And, at first I wasn't sure about, what I'm going to do at the program. But as I go into it, I felt like really that it has helped me be more of an active participant in all of these initiatives, as opposed to just being a passive one and just listening and then passing the information to my staff. So this program really helped me a lot into, like, really understanding the why behind the what. And that has helped me become a better leader, I feel. And I hope that I still continue to be able to do that. Just like John, I'm still doing the 4-year program because I work full time. I wish my schedule was not as hectic so that I could do it in 2 years, but it really wasn't the right fit for me to be able to do that. But I'm very thankful for the opportunity and just the vast input from my classmates, understanding their point of view. I get really excited about just learning about that. So thank you very much.
Okay, thank you so much, Melanie. Okay, so tonight we will be discussing the patient safety industry, careers in patient safety. We will go over the program details, curriculum, chat a little bit about the interdisciplinary collaboration and online learning here at Hopkins, highlight some of our amazing faculty, chat about the admissions requirements, tuition and financial aid, and then at the end, we'll have a little bit of a Q&A with our panel, and then anyone on the call can definitely feel free to ask any questions that they may have as well. Okay, and I will hand it over to Albert to get us started chatting about the careers in patient safety.
I could do that, but I think what I'd like to do just really quickly is get Jordan, David, Gabby, and just Shiri to just say hello, and explain why they're on this call.
Hello, I'm Jordan. I'm basically on this call because I'm working on applying for fall 2025 and just, like, public health. I haven't quite narrowed down, like, specific programs as much quite yet, but yeah, I'm still an undergrad right now, just into public health type stuff.
Great. Welcome. Anybody else?
Yeah, hi everyone. I'm Jayshree. I'm calling from Singapore, so it's like 6 a.m. here.
Wow.
Yeah, really excited for this. I am a medical graduate who is currently working in public health and specifically value-based healthcare. I'm looking to apply for this program for the upcoming intake. Yeah.
Let's see, it's either very early or very late. I guess it's probably early for you.
It's 6 a.m., which is not too bad.
David or Gabby?
Hi, everyone. I'm Gabby. I'm calling in from New York. I'm actually a veterinarian who is interested in building a more robust patient safety program within our multi-site hospital organization. Patient safety, adverse events is not nearly spoken about as much in our industry for many reasons we can hypothesize, but it's certainly a passion of mine. So really hoping to build more structure and tools around patient safety initiatives and creating a safer culture within our hospitals for our four-legged patients. Thank you so much for all the information.
Well, Gabby, oddly enough, you've come to the right place. We have had a history of now prominent veterinarians in patient safety come through the program. So this could be the place for you.
Really excited to hear that. Thank you.
We may inject just a tiny little bit of that somewhere in or you could ask questions.
I
David,
will support that as well, Dr. Wu. Sorry.
David, I don't know if you have a mic. Well, why don't as David's looking for his mic, I'll get started, but David, you can barge in if at any point if you find your voice. So yeah, I think that there are, just about everyone who works in healthcare is interested in patient safety or is fearful about the lack of safety and quality, at least at times, in the places they work or in the work they do. But the problem is that in most institutions, there is a real sort of gap, and that is there are not faculty or staff or leaders or managers who necessarily have the fundamental expertise or knowledge of the science of safety. And there isn't much direction for how you might design a project to improve safety, or what data you might collect that's relevant to safety, how you might analyze those data, and what steps would you need to take if you wanted to make this a bigger part of your work. And welcome to Ursula, who looks like just signed on.
That's fine.
Ursula, where are you coming in from? Where are you zooming in from?
I'm in Lakeland, Florida.
Well, welcome. We're just reviewing a little bit of sort of where this course is aimed and some of the things we do. So in any event, having a lot of people, and I like, sort of the comment about from Melanie learning about learning to understand the why behind some of the things that we actually do, what we do to do the right thing. But why is it that we're doing that? What's the basis for that? And I think the basic science and the concepts behind safety and healthcare quality are really appealing and useful. And having a grasp of those things could help almost any healthcare provider and might also lead to a sort of a new direction in careers. And we've listed here just a couple of jobs that increasingly involve and require expertise in safety. They might be director of quality management and patient safety. They might be to be a patient safety officer, if not the director of those things. They might be a position working in or even directing clinical quality improvements. There are executive level positions, vice president of quality or outcomes or safety, and there are also consultant positions. So these are just a few samples, but there is more and more demand, and I think that virtually every organization now has positions that relate to quality and safety. Next, please. Peter Pronovost, who was here at the beginning of patient safety, and who I began working with in the late 1990s, said organizations profess patient safety as a top priority, but they are still figuring out how to manage it with the same rigor, discipline, and accountability that they do with their budgets. And we talk about accounting. We hear a lot about accounting these days in healthcare, but what about accounting for safety? Some number, this is not accounting, but maybe it's just counting. Some numbers are that repeatedly research and studies have shown that on average, about 1 in every 10 people hospitalized is harmed while receiving care, which was intended to help them. There are easily 1.5 million preventable adverse drug events, harm from the use of drugs in the US. The cost of harm that results from things not going in the right direction could easily exceed 100 billion a year, and I've heard higher figures. And even though they're not quite so obvious, inaccurate diagnoses, the failure to diagnose or a diagnosis that is made only when it's too late, are perhaps the most common catastrophic and costly medical errors. We're just actually discovering this because it's kind of hard to measure incorrect diagnoses. Next, please. So our program is a full Johns Hopkins master's degree program. It is one of really a group of master's and doctoral programs taught by the university, mostly out of the School of Public Health. It is very skills-based. We are aiming to equip mostly working professionals with tools to understand and improve safety. The course is intended to be part-time, and it's 100% online, so that if you happen to be in the Philippines, you do not need to drop in every week for a seminar. It is 48.5 credits, and Hopkins has 4 terms a year. And to complete the program requires at least 2 years worth of courses. That would be 8 terms. The courses, there are courses, but there are also professional development activities. And at the end, there's an integrative activity in which you take what you've learned, apply it to something that is troubling you, a problem you're trying to solve, something you want to know much more about, and that is a course, which is an integrative activity. Hopkins is a leader in the Hopkins School of Public Health in particular, is very skilled and very experienced in teaching methods and skills. And so I would say that we are quite up to date in how we teach our courses. The material is very skills oriented. It includes a fair number of projects, a fair bit of project work, and confronting problems directly. There is a focus on public health. It's not just treating individual patients, but also thinking about populations and making care safer and better for everyone. And so we work on helping students learn how to measure safety and quality, design safer symptoms, to understand organizational and cultural change and what is needed to accomplish these, to be patient-centered, and simply to prevent common harms that recur over and over in healthcare. Next, please. So this is the basic curriculum. There is a fixed curriculum. So if you were to do this degree in 2 years, though it can be done in 3 or 4 years, you need to take in the first term a very brief ethics class, but then an intro to this has been switched recently, an intro to the science of safety, and some basic seminars in public health. In the second term, an introduction to the quality of care, which Paula, in fact, is leading. Another course on case studies from all sorts of kinds of problems, and for that matter, from different countries, on quality and safety gone wrong or perhaps improved. In the third term, you take an intro to epidemiology course. This is a public health degree, and you really need to understand how to count things. There's a course also that term on writing to get results, writing for results. And I think this is very important. It's important, particularly important, if you are not used to writing documents, and if you're not particularly used to writing documents in English, this can help you not only in our program, but in your work in general, I think. Term 4, again, some basic statistical concepts. Again, you need to know some basic statistics to understand and figure out whether or not things that you read about are believable. And there's a really, I think, kind of a cool class on leadership, leading to change. In year 2, the first term includes the second biostat course, and a course on tools that are commonly used to improve safety and quality. So you will be equipped with knowledge and ability to apply those tools. Second term, the second course in epidemiology, another seminar in public health. The third term, I think, is a lot of fun. It includes a measurement course, which is how to measure and evaluate quality and safety or interventions, and an infection prevention course, which is really a crucial issue in healthcare settings. Finally, in the fourth term, the integrative activity is half of what you do, and there is an accompanying measurement lab to help give you some tools or help you review some of the tools that, in fact, Dr. Austin teaches. It's really a lab on how to measure safety and quality, and you are very likely to use some of those techniques in your final integrative activity. So that's what the 2 or 3 or 4 years would look like. You might spread things out a little bit differently, and in fact, you might only take a course per term. I would say that on average, a 3 or 4 credit course might absorb, say, 10 hours of your time in a week. If you're taking 2 courses, it might be 15 or maybe, I would say less than 20 hours, maybe 15 hours, is what you might spend on the 6 credits in a term. Next, please. This is a very interdisciplinary course, and that is because patient safety and healthcare quality is necessarily very interdisciplinary. If you want to understand a problem, it's never just the doctors, just the nurses, just the technicians, just the lab, just the pharmacy. You need to follow the patient as they travel through their episodes of healthcare. This class is a joint effort, even though it is accredited through the School of Public Health with the School of Medicine, the School of Nursing, and the Armstrong Institute, which is one of the leading, perhaps the leading patient safety institute based in an academic medical center in the US. The people who lead the courses are people who also lead safety and quality for Johns Hopkins Medicine. The Armstrong Institute is in charge of safety and quality for all of Johns Hopkins, I think deservedly highly esteemed medical care. And so I think that you'll find that many of your classes are taught by one of, or perhaps the leading expert in that topic. Hopkins has been teaching online for 25 years now. During the pandemic, every one of Hopkins' several hundred courses was converted so that it could be taught fully online. And the production values, I think, are very high. They're designed to keep you awake because it is all online and they need to be engaging if you're calling in from, zooming in from, in the middle of the night or early in the morning. Everything is recorded so that you can review over and over. It can keep you engaged, it can keep you awake, it can lull you to sleep. You can make sure that you don't miss anything. This is also helpful if, again, not everything you do is in English. The fact that all of this is recorded, videoed, transcribed, and can be reviewed at any time, I think can be very helpful. Next, please. So we are most proud of our faculty. And I think that is really besides our students, of course, I think that is our greatest asset. Just to pull a couple of people out of the line. Matt Austin, whose first name is really John, but no one ever refers to him as such, is the lead for measurement and analysis of safety and quality for the very important Leapfrog group of employers that, in fact, in many ways leads the measurement of and ranking of healthcare organizations. Lisa Maragakis, down at the bottom, is the director of infection control, hospital epidemiology and infection control for Johns Hopkins Hospital and Johns Hopkins Health System. During the pandemic, she was the lead commander for our incident command center for COVID. And in fact, she was, for a few months, was really in charge of the whole medical system, I would say. Jill Marsteller is a trailblazer in evaluating healthcare safety and quality. John McGreedy is a statistician who everyone who in other courses in our school wins the Golden Apple Award for the best teacher because he makes biostatistics understandable. If you attend his lectures, at the end of the lecture, you actually believe that you can do it yourself. Lori Payne is a nurse who is the director of patient safety for Johns Hopkins Hospital. Peter Pronovost is one of the really top experts in patient safety, is responsible for the now widespread use of checklists in patient safety in targeted areas. Mike Rosen developed a lot of teamwork training in patient safety. Kathy Sutcliffe originated the whole concept of high reliability organizations, and is the leading expert in the world on this topic. So I've only touched on a couple of our instructors, but as you can see, this is a great group of people who you can learn from directly. Next, please. Oh, I'm gonna pass off now back to Morgan,
Yeah,
because she's in charge of.
thanks so much, Dr. Wu. So yes, would love to chat more about the admissions requirements and application process for this program. So to get started with us, we would need you to submit your application through SOFAS. We require students to have completed their bachelor's degree from an accredited college or university. We would need your official transcripts for all of the colleges, coursework that you completed. So that little community college class you took 1 year in undergrad, we need that transcript too. So all of your transcripts we would need submitted directly to SOFAS. We require students or applicants to have 3 years of health-related work experience. You can show that you have 3 years of health-related work experience in your resume, or that's something that you can highlight in your statement of purpose. Now, your statement of purpose, I would say, is the most important aspect of your application because it gives you the opportunity to really introduce yourself to the admissions committee. I think it's very important for you to share your understanding of the program, what makes this program a great fit for you. Um, how are the skills and knowledge you plan to learn in the program going to be applicable to your career and your career goals? And you will also need a minimum of 3 letters of recommendation. The letters of recommendation can be from your colleagues. We suggest one, at least one be from a supervisor or any type of superior. You can have a maximum of 5 letters of recommendation. Now, although 3 is the minimum, I would say students should provide more letters of recommendation if maybe their application might be a little bit weaker in a certain area. Um, I think the 5 letters of recommendation can kind of, really boost you up if you get good ones. For our international students, you have to do 2 additional things. So one would be possibly take a English proficiency exam. Now, there are certain ways that international students can be exempt from English proficiency exams. I would definitely say reach out to me and we can discuss it a little bit further. But one example is if you are an international student that has went to school in the US, got your bachelor's degree here. That case, you would be able to be exempt from the English proficiency exam. So there are different ways that we can kind of try to get you exempt from that if need be. Also, international students would have to have their transcripts evaluated by WES. You would need to do a course by course evaluation through WES. So all coursework that is not completed in the US or English speaking Canada would have to be evaluated. Again, those details you can always reach out to me and we can chat about a little bit further. Um, Applications are reviewed on a rolling basis. Now, although our deadline is July 1st, I do not suggest students waiting till, close to that date to submit their application. I always say sooner rather than later, especially if you're one of our international students. Although sometimes the applications can, be submitted very quickly, very smoothly. Sometimes they take a little bit longer than we anticipate for things like getting transcripts in, having them evaluated, waiting for those letters of recommendation. You want to give yourself more than enough time to get everything submitted. So you can get started with us this upcoming August. Um, Another great aspect about this program is that we are giving out scholarships to all students who are admitted into the program. So once you are admitted into the program, you don't need any additional application to get our MAS scholarship. The current tuition is $1,374. And then the scholarship, let me catch up with the slides. The scholarship is $528 per credit. So the scholarship brings us down to about $846 per credit. Another thing, we chatted about taking your time to matriculate through your program. You would also be charged each term depending on the amount of credits you take. So if you're taking 6 credits each term, you'll be charged for the 6 credits. If you're taking 3 credits each term, you will be charged for the 3 credits. Outside of scholarships, we have a whole financial aid office. I have a list of different scholarships, external scholarships that students previously have used. So if you're interested, definitely reach out and I can send that your way as well. Okay, and now I will kick it over to Dr. Austin, and we will chat a little bit with our guests and have anyone else on the call ask any questions.
Yeah, Morgan, thanks so much. So I'm hoping to maybe spend I don't know, 3 minutes with each of our guests just to hear some of their insights on the program. And so what I might ask of each of you, meaning Melanie, John, and Rod, maybe the 2 questions I would want you to answer for the group. One would be, what have you liked most about the program? And what have you found to be most useful? So, Melanie, are you comfortable going first with that?
Yep, sure. So what I really like most, and probably the most useful as well, are the fact that the classes that we were taught is readily applicable. Like I could just use it right away. And I remember John mentioning this, that for some reason, the timing is always perfect. Like I remember talking about, like just in my recent class, they were talking about culture of safety. And that happened to be added as a QPS goal for the hospital that I work for. And I was recruited to be part of that. So those things, like, in other schools, like you learn about theories, but then the question would always be, what do I do with it? With this class, I find it like the examples, just what they discuss in the lectures and the assignments could really be easily applied to, the location that you're working for or the setting that you're working for.
Nice. And I do have a follow-up question for you. What drew you to this particular program? What was appealing for you?
Yeah. So I'm as a physical therapist, like, when I'm looking at programs that is outside the physical therapy world, I really don't want to go into just admin. Like I'm a supervisor right now, but some of the programs that I looked at, it was mostly geared toward just administrative things. What I really like about the program is that I feel that it still connects to the clinical part, which I really love. So it just takes it further to understand, what your contributions could be. So I think of my profession as a physical therapist. I feel like as a physical therapist, we have a lot of things to contribute, probably underutilized, if I would be honest. But I think of all those things, like, Johns Hopkins. I've attended a lot of seminars from Johns Hopkins, and I feel like they're the pioneers of a lot of things, in terms of pulling in the rehab resources to work on other initiatives. So that really, that was the deciding factor for me.
Wonderful. And I would fully support that physical therapists are probably an underutilized resource in our healthcare system. So we're glad to have you. Rod, do you want to maybe share a couple of thoughts about what you've liked most about the program, what you've found useful?
Yeah, absolutely. I mean, obviously you said useful and what you like most. The answer to both of those questions, the short answer is everything, but to get more specific, and I echo pretty much what the others have said, it's the applicability. So it's a rigorous program. They teach you the science, the theoretical underpinnings, the frameworks, but then they teach you how to do it. How do you actually do this stuff to impact you talk about this as part of the School of Public Health, because I view this as a public health exercise. I mean, for 30 years of general surgery practice, and I always, I'm a great surgeon. Every surgeon thinks he's the best surgeon in the world, but then they would ask me, oh, well, what's your complication rate? And I'm like, gee, I don't know. It's good. And then a couple of years, right after the pandemic, that seems to be the pivot point for a lot of people. I thought, we need to look at our quality better. And this was just in the surgical realm, because that's what I do. So I convinced our hospital to participate in NSQIP, which, for those of you who aren't familiar, is the National Surgical Quality Improvement Program. So it's a quality registry, so you can monitor outcomes and 30-day risk-adjusted complications, mortality, and so forth. It's very sobering to look at that data, but I had all this data, mountains of data, and I had no idea where to even start or what to do with it. And that's what got me interested in the program. And not in this program specifically, but in seeking expertise, because what I found was that at our hospital, and I'm speaking for our hospital alone, we had a lot of, quality is done in sort of a scattered sort of way. It's a committee for this, a committee for that, different people. Nobody talks to each other, but most of those committees obviously are staffed by nurses primarily. And I found in my experience that they had a hunger to do this stuff, and they wanted leadership and help and direction and participation from doctors. And so I started researching programs, and Johns Hopkins came up, and that's, to me, is a no-brainer. I mean, Johns Hopkins, me as a physician, it is a storied institution. I mean, luminaries from the world of medicine, public health, safety, quality are all out of Hopkins. And even now, when I mention to people about I'm in this program, and they go, oh, yeah, where are you doing? I say, oh, it's Johns Hopkins. And they say, oh, really? And suddenly they're interested in what I have to say. And I'm hopeful that this will help move the needle at my own institution, as I pivot. And maybe, I don't know if there's any older folks in the crowd that are interested in this program, but this is a good career pivot as you get older, because you have the experience, the clinical wisdom, the accumulated years of relationships with people, which you can then use to benefit patient care sort of writ large, in orders of magnitude more than what you would ever be able to do just individually, patient by patient. So it's been fulfilling, it's rigorous, it's a lot, and I'm in the 2-year program, so Lord, and I'm still in busy private practice, so it's a lot of work. What Dr. Wu was saying about the hours put in, that's accurate. It may even be an underestimate, honestly. You have to put the work in. If you don't stay ahead of this stuff, it'll eat your lunch for sure. But that being said, the double dipping that was alluded to, I've been doing that from day one. I've used stuff even at this very moment. We're working on an initiative for decreasing surgical site infections in the colectomy patients based on our NSQIP data, and that's all from the safety class, the safety tools, improvement tools that we're doing now. I'm using all those techniques I've been implementing at all these meetings. It's what we're actually using to do this stuff. So it's practical, it's theoretical, it's grounded in solid science and theory. It helps you think critically about these things. And I mean, I just can't say enough good things about it. I'm sorry if I monopolized the time, but I've become an apologist for quality and safety.
Well, Rod, thanks so much for sharing your experience. John, since you're now our alum and graduate of the program, what did you like most? What did you find most useful?
To kind of echo what Melanie and Rod have said, what I'd like most would be, and this is going to sound like I covered everything, the material and the people. The material, every class, and I'll talk about this, the usefulness is directly applied to what I do in work. The professors, the professors are, as Dr. Wu said, the world's experts. I was just looking around within reach of my desk here for some props. I don't know if this will show up in the blurring.
No.
These are, I'll go off blur for just a moment if I can. This is Dr. Sutcliffe's books. And that's how much I use Managing the Unexpected and the high reliability organization. And I'm gonna go back to blur because my office is a mess. I guess another key point I would say is make sure you read, when you have the chance, your professor's books and their publications. Incredible. And then the other thing is the people in the class, your cohorts. You learn so much from them, as Melanie was saying, and it's just an incredible collaborative experience. You've got the guidance of the world's experts. Dr. Wu was a little modest saying in America, it is actually the world experts on patient safety, healthcare quality. They're accessible. I reached out to them. The professors, Dr. McGreedy was incredible. I was a mathematics undergraduate degree, and I was up, because I'm in California time. So he had his office hours at 8 in the morning. I was up at 5 in the morning, every office hour. And I had just some incredible learning one-to-one with him. And you can't replicate that otherwise. What did I find most useful? And that was all the classes. And I could talk for hours. I will try not to. I think we have about 7 minutes left. I will keep under that. So many projects I've worked on, as I talked about the double dipping. Most recently, this week today, I am working on a project on radiological imaging room classifications. And I'm the only medical consultant that has really consulted on this. And it's mostly engineers and looking at the physical requirements of the room. And they reverse engineered a database to get the results they wanted. And from Dr. Austin's class, I know about measurement. From the statistics and the epidemiology class, I've learned about regression analysis and risk assessment and coefficients. And I was able to explain to them that your database is not based on patient safety, patient outcomes, and is invalid, and then was able to show them the invalid results, and then was able to suggest we have an opportunity here to improve systems and to improve patient safety for California patients. And this is all directly from my Johns Hopkins work. I could talk about other projects, but I'll save that for a future talk. But I am so grateful for this opportunity and what I've learned. And as Melanie said, the just-in-time learning, I don't know how it worked out that way, but every semester for 4 years, I had the class I needed at the time I needed. When I first joined the medical consultant position at the state during the pandemic, they had originally done mentoring training of the medical consultants, and they had lost most of the medical consultants. They had 14, they were down to 4. And in the professional writing class, I was able to write my assignments on how can you redesign the program to do policies and procedures and checklists to train medical consultants. I mean, I could go on all day. I'm gonna stop now, but it's an amazing program. I'm so grateful to be here to share how wonderful this has been to advance what I can do to advance public health, population health. Johns Hopkins saving lives, millions at a time. It is true.
Great. Thanks, John, so much. And thanks, Melanie and Rod. I do want to make sure we have a few minutes for our future Blue Jays to ask any questions that they might have of either our current students or alums, Dr. Wu, Morgan. So with that, I'll open it up to any other to questions that our future students might have.
This is your chance. Don't be shy.
I'm bad at coming up with questions on the spot, but I'm sure I will email. I know I'll come up with a bunch later, but not always great on coming up with them in the moment.
And that's
Well, please.
absolutely fine. Please know that your resources are present. Some of your resources are present on this call, and we're all eager to support you and make sure that you have made the right decision and support your journey. So don't hesitate to reach out to us.
You know, I wanted to add that to Morgan, if it would be useful, if she wants to share my email address with any of the students, if they want to get a student's perspective, I'd be happy to email with anybody. So.
I apologize if this was already answered. I'm just doing 10 things at once, but I know you mentioned that the lectures are recorded. Are they provided live that you can interact with the professors at and then recorded if you're unable to make it at that designated time, or are there just recordings being published every so often for you to watch on your own time?
So there are, for each course, there are, I would say, 3 on average or more live talks, which run at a specific time, which still may not be convenient for everyone, but they're often at sort of 5 or 6 Eastern time, so that it might be possible for people to, without too much punishment, to attend from all over the world. The other courses are already recorded, and so they can be viewed at any time. They can be binged. If you happen to have a little bit more time. I think there are advantages and disadvantages, to that model, but many of the people taking the courses are not, their lives are better suited for viewing 4 or 5 lectures on a weekend and then working during the week, for example. So we found that since this is really an online course with no required on-campus time, that works.
That's great, thank you. And how far in advance of the actual coursework starting will we receive the schedule, just in case we want to ensure we are able to attend any live lectures?
The live talks are all scheduled before the course begins.
Okay, great, thank you.
Yeah, as an example, Gabby, I teach a 4th term course, which is in the spring, and we're already working to identify the dates and times for those 3 live talks. What other questions? Yeah.
Yeah, Jaytree here. Thanks for the talk. I had a question about some of the existing courses that you already have on Coursera, like the patient safety specialization. I think it's like 7 courses. Is that content related to the content in this degree program, or is it a separate set of content? Thank you.
I think the question might be about the Coursera offering. Is that what you're speaking to?
Yeah.
So that is entirely separate, though some of the lectures are taught by some of the same people who teach the MAS. And so there probably is a little bit of homology between the material in the 2 examples. That I think that those lectures might be a sample for the kind of thing or the kind of lecture that you might get.
Okay, cool, because I'm really enjoying those. So if that's like a taster, then that's really awesome. Thank you.
Yeah, I would say the added component, or one of the most significant added components, I think, is sort of the work around deliverables, papers, projects, assignments, which is probably where a lot of the real learning goes on, right? Is actually when you have to apply what you've learned to a particular, assignment, paper, or project. So I see that as being the real significant sort of addition with the MAS program.
And also taking the class with a cohort of people.
Yeah, exactly.
So you can learn from your classmates.
Thank you.
Any other questions that we could answer for you all tonight? Well, I am happy to stay on for a few minutes. I know we are past the top of the hour, so with Morgan, I'll turn it back to you if you have any wrap-up comments to make.
Yeah, thank you so much, everyone, for attending our session today. Again, a special thanks to Rod, John, and Melanie for being our special guests in our session. Again, applications are open, so definitely feel free to submit your application again sooner rather than later. If you have any questions about the program or application process, feel free to shoot me an email. You can find my email on the screen. It's mas-office@jhu.edu. And again, thank you everyone for attending our session today.
Thanks, everyone.
Thank you.
Thank you.
Think up some questions, Gabby.